Good morning. Welcome to Payroll Services webinar on ObamaCare, understanding how to position your company for the upcoming changes. This morning we have a nice group of people ranging from employer sizes from 1 to plus 200. We have a bunch of accountants and CPAs as well as some financial planners here. So what we're going to try to do is give you a bird's eye glance over the upcoming changes. These are the changes that we know of effective around August 15th or so. Obviously this thing is always changing, so this is based off of what we know today. First off, who's Payroll Services? Payroll Services, we're a full-service payroll, HR, and employee benefit company. We're located here in Urbana, which is right outside of Frederick. We work with over 4,000 employees nationwide and mainly with employers between 1 to 500 employees. So we do a lot of different things, and we have a lot of experience, and we see what's going on in the marketplace for benefits and insurance. Some of the things that we're going to discuss today is how you should be viewing your benefits as an employer. Are you under or over the 50 full-time equivalents? That's what FTE stands for. We're also going to take a bird's eye glance at the over 50 rules. They're different than the under 50. There's two types of exchanges we'll talk about, and then we'll try to get a basic understanding of some of the rates and how the subsidies work inside Obamacare. And then we'll talk briefly about some strategies and planning, and then I have a couple of examples for you with current rates and what we think some of the rates are going to be based off of information that's available. If you have any questions, please feel free to use that little box and type in your question there, and I'll answer questions at the end. And then obviously you can always contact us after the webinar. We will keep this to 30 minutes. First, the first thing is how should you view benefits as an employer when you're setting things up? Obviously, we want to maximize benefits and minimize the cost. And the first thing in order to do that is you need to realize and make sure that when you set up your benefits that it's not compensation. Benefits are benefits, compensation is compensation. If you want to give your employees more money, do it through payroll in the way of raises or bonuses or whatnot. Benefits are never considered immediate money to employees. That's why we always advocate to put the actual cost of the benefit on their pay stub. That way they can see the actual cost of the benefit that you provide them. One of the things that we look at when we talk about benefits and planning is what we call the 3 C's of insurance: cost, convenience, and coverage. Cost is a no-brainer. Convenience is, are the doctors in your area? Do you have to drive 2 hours to get somewhere? And then coverage is what is included in that insurance. If you break an arm, is that included? If you have to go to the doctor for a boo-boo, is that included? You can find out more information about the 3 C's of insurance on our YouTube channel by visiting our website, which is payrollservicesllc.com. I don't want to spend too much time on that right now. So the first question is what's a full-time equivalent, and are you over a 50 full-time equivalents? A full-time equivalent is an employee that works 30 hours or more per week per year. If you are an employer that has a lot of part-time help, maybe you're a restaurant or a daycare center, just because you don't have an individual that may work over 30 does not mean that you're not falling into this category. It's a mathematical equation where we take all the hours worked in the entire year by your company, and then we figure this out. So a full-time equivalent is not a person, but a mathematical definition. Seasonal employees, if you're a lifeguarding company, if you're an ice cream stand, 120 days or less, if their employees work in a year, you are considered exempt from that full-time equivalent for those employees. So seasonal employees are exempt. One of the big questions that we have that we're trying to find out about is, do dependents count towards the FTE equation? A lot of you know that with the changes in the healthcare law that dependents can now stay on their parents' plans up until 26. So the question is if that is a dependent, does it count to the full-time equivalent? We do not know yet, and that hasn't been defined yet. So that is a big question mark up there. So let's say you find out that you're over 50, and now what do you do? Fortunately, the over 50 rules are delayed until 2015. But there's a lot of different rules that are coming into play, so we strongly recommend that you start figuring out what's going on, even though a lot of things are up in the air. First, you're going to be subject to a new tax return that you have to do, and essentially it's going to report who is a full-time equivalent. Social security numbers are going to be on there, names. It's going to be very similar to your unemployment reports that we file now for clients. You must provide health insurance if you are over the 50 FTE, or you're going to pay a penalty of $2,000 per employee minus the first 30 employees. So let me explain that a little bit easier. Essentially, if you have 50 employees, before the penalty kicks in, you get 30 employees free. So if you have 50 employees, we subtract 30, which would leave you 20. 20 times 2, $40,000 would be the penalty. Now, a lot of people are going, oh my gosh, that's nuts. You're going to penalize employers $2,000. Anybody that provides health insurance for their employees knows that we pay more than $2,000 a year for their employee. So even though it's a $2,000 penalty, employers can go ahead and get rid of coverage and save money by paying this penalty. It's just the way that the law is written for it. If your insurance is not deemed affordable, there's going to be a $3,000 penalty per employee that's eligible for subsidies. Essentially, this is with the pay or play. Affordable is a definition in which it's basically math. The way that it works is that if you have insurance and you offer it to your employees, and that employee falls on a math equation and it comes up to equal not affordable, where they could be eligible for a subsidy through the exchange, you would be fined for $3,000. Now, there's a little bit more to that, but essentially here's what I want to highlight with this. Just because you offer insurance and you're over 50 does not mean you will still be able to get away from paying a penalty. Let's take some examples. If you have 500 employees or 200 employees, you have to make sure that the amount of insurance that you're paying for your staff is considered affordable for each and every one of them. If it is not affordable, you would have to pay this $3,000 fine. Now, practically, that is extremely tough to do because, like I said again, affordable is a mathematical equation that actually equals something. So you would have to go through and run this equation for 200 employees to find out who it's not affordable for. You would either have to pay more for their insurance, or you would have to do something to make sure you don't get penalized $3,000. The point that I want to show with this is it's very difficult to figure out who is going to fall on this not affordable or affordable scale. Some of the suggestions that we have made is, if you don't want to have to deal with this, is that you're going to have to pay a good portion of the insurance. So if you're paying 75% of the insurance for the employee, you're probably okay. But whenever you fall under that 50% mark, or maybe at 50%, insurance could still be deemed not affordable and you're still paying a penalty. So the administrative burden on this is quite substantial. When we look at this exchange and the Obamacare, we want to look at it as a business standpoint, not as a political side. It's here right now, so we want to make sure that we position our companies the best we can. With the over 50 market, it's very difficult because of all these ifs that are out there. We have this $3,000 penalty if the insurance isn't affordable. And then you also have to figure out what your full-time equivalents are. So the administration on this is quite extensive, and that's why some companies are considering just dropping their insurance. And we'll visit why that's a good or a bad thing later on down here. There's two types of exchanges outside of the over 50 market. In the under 50, you have what's called the shop exchange. That's small business. It's under 50 full-time equivalents. In some states, it's under 100. In Maryland, it's under 50. The second exchange is the individual exchange, and we'll talk about that. The most important thing you need to understand with this is these exchanges are not run by the government. These are current carriers you're familiar with. Care First, United Healthcare, all these other insurance carriers, they're actually providing the insurance. What the government, the quote-unquote government run is just another set of standards that carriers have to comply with. In Maryland, And in most states, we have state insurance agencies already. They are the ones that approve rates and approve carriers coming in and out. So we already have this quote unquote government insurance, if you would call it. What Obamacare does is just adds another layer as a federal regulations. Insurance has always been regulated on the state side. So again, this is not government insurance. You're not buying the United States of America $1,200 high deductible plan. You're going to buy a Care First product. You're going to buy a whoever. And obviously, the carriers that enter the exchange, those are the ones that you'll shop with. Some of them, they're not forced to be in the exchange. Some of them are leaving. Some of them are staying. Care First is one that's staying, which will be a predominant one. The small business exchange, again, is for employers that are under 50. Here's the big catch. If you're under 50 full-time equivalents, you are not required to provide insurance of any type. You're not required to pay for insurance. You're not even required to lift a pen to set up insurance. You are not required to do anything. Okay, so you guys can take a big breath that are under 50 that were nervous about that. There's nothing that requires you to do that. And we'll talk about some strategies as to why that may be a good idea. Employers that enter the shop exchange may be eligible for a tax credit. So let me just spend a little bit on how this works here. The exchange is set up into two ways that we've talked about. We have the small business exchange and we have the individual exchange. We know that employers under 50 are not required to offer insurance to anybody. They don't even have to set it up. So you would be like, well, then why should we even have this here? Well, what they're trying to do is I'm a broker, and if I come out and I talk to 50 individuals, that's 50 individual plans that have to be managed. It's easier administratively if I, as a broker, come out and talk to an employer group that may have 10 employees there. So instead of dealing with, let's say, 50 individuals, I could deal with 5 businesses that have 10 employees. So it's just administratively easier. They're not required to set up to go through the shop. They're not required to pay for any of the insurance or anything. Now, what Obamacare tries to do, and this has been out there for a couple years, is it tries to give employers tax credits for providing a portion of insurance to the employees. Now, we have probably about 150 or so lives that we broker for. We have not seen any employers that are actually eligible for this tax credit yet. And we manage about 250 accounts. I'm not saying that it's not out there and that somebody doesn't apply. We just haven't seen it through our client base that anybody's been eligible for it. But this is the carrot that's being dangled. Hey, offer insurance and we'll give you a credit that may pay for half of it or whatever. Most of the time that's not the case. So again, these are some of the options that have to be weighed. Now, employees who go through the shop, which again is a small business exchange, will not be eligible for subsidies through the federal exchange. Excuse me, the state exchanges or the federal exchanges. And we'll talk about why that's important later on. When you go through the shop, again, small business, what I would do is I would come out and say, hi, Mr. Employer, let's go ahead and get your company set up for a health plan just so your employees can enroll. You don't have to pay anything. There's 2 methods that the employer chooses on how to select a plan. The first one is what they call the employee choice. We basically pick a single carrier and multiple plans. The way the exchanges are set up is it's a tiered plan system based off of metals, whether it's bronze, gold, platinum, whatever they are at the time. So the employer would say, okay, Jonathan, I want to choose Care First, and then I want to let my employees choose which plan they want inside Care First. The second choice is where we as the employer chooses a plan type. So he may say, okay, I picked the bronze plans type or whatever the plan type. And then the employee goes on and chooses what carrier he wants to use. So he could select from any of the available carriers that offer the bronze plan. Those are the 2 methods of picking the plans for the employees. And again, the employer holds the keys for this, guys. When you're starting to plan all this stuff, it's important as the employer to recognize that you're the one that's going to dictate cost and plan types. The individual exchange, we're going to spend some time talking about this because this is really where I see that the healthcare reform pushes for. Any individual can go through the exchange if insurance is not offered elsewhere, okay? And I have some stars there. Essentially, if you were over 50 in an over 50 business, or you have a spouse that's in the over 50 and they have insurance that's offered there, you have to go through that company's insurance. If there's a shop exchange set up in a small business, you must go through the shop exchange. You can't just say, hey, I want to go to the individual exchange. And again, this is why I say it's important for the employers to understand what's going on here. There's a catch though. If you're in the over 50 group and you have insurance that is deemed not affordable based off of that mathematical equation we talked about earlier, you then have the ability to go to the individual exchange and receive a subsidy, okay? That's how those over 50 employee groups will get penalized at $3,000. Employee has insurance, he could get it cheaper through the individual exchange, so he dumps it and goes to the individual exchange. He signs up there, company gets dinged $3,000. That's how that works. It's called the free rider option. Here's the important thing. We have the over 50 groups, we have the shop, which is under 50, and the individual. Only the individual exchange offers subsidies. And it's subsidies based off of for premiums. Again, the free rider, I spoke briefly about it. It's if you work for a company that has over 50 full-time equivalents, or a spouse, or you have insurance that can be accessible through that. If it's deemed unaffordable, then you can go into the individual exchange. So what are the rates going to be based off of? Everybody's been asking, well, what's the rate? So my rates are going to go up, you're getting early renewal notices saying, hey, take this deal now, and they're like 30% increases. So what do we know about the rates? Well, first, in Maryland, Maryland basically has what we call a community rating. If you have group insurance, what we do is we find your average age. So I go into your group, I get all your employees together, and I figure out what their average age is. And that's what your rate is based off of, average age and the zip code that you're in. Right now, for the individual exchange, it works similar for individual insurance, it works similar, whereas it's based off of your age. Now here's the catch. There's these things that we call age bands. Age bands basically bracket you together into what group of age you fall into. A 20-year-old is going to pay 5 times less in insurance premiums than if somebody is 60. We call that a 5-to-1 ratio. So the older you get, you're going to pay 5 times more than a younger person. So that's an age band of 5-to-1. With the new ObamaCare rules, they changed the age bands to 3-to-1. And what that means is that the younger and healthier are now subsidizing the premiums for the older and sick. So you will see when they say, hey, the youth's premiums are going to go up, absolutely, and that's because of the age bands have been shrunk from 5-to-1 to 3-to-1. The new rates are going to be different. The rates for the shop, which again is under 50, and the individual exchange are all based off the same methodology. It's going to be based off of the individual age of the employee or the individuals going into the individual exchange, and whether they're a smoker or a non-smoker, and their zip code. It's not based on the average age anymore. So if you have 10 employees working for you right now, and we go through this shop, each individual employee is going to have their own separate insurance premium rate. And that's where it gets a little complicated for administrating costs and things like that for groups. Same thing for individual exchange. You go into the individual exchange, the rates are going to be very, very similar. But again, the individual exchange only allows for subsidies, whereas the shop and the over 50 do not. The important thing when we start talking about this next one is this. The cost of insurance, Obamacare does nothing to control the cost of health insurance. It controls the cost for individual premiums, okay? Healthcare costs are not affected. The individual insurance premiums are absolutely controlled in Obamacare. They achieve this by subsidies. Essentially what this means is that they're going to take your income, throw it up on a chart, which is the federal poverty level. And if you are up to 400% of the federal poverty level, your premiums are going to be capped. So at this chart here essentially says this. The premium could go up to $1 million a month, but you will only ever pay a percentage of your income based off of this chart here. And that's how Obamacare achieves this affordable affordable care or whatever you want to call it in this case. But it does nothing to control the cost of health care with it. Now, if you're over 400% of the federal poverty level, then your premiums are uncapped and you're going to be getting hit the hardest. But let's take a look at what some of those incomes look like. Inside the subsidies here, this is found by going to the Kaiser Foundation, and you can actually plug in some of your income levels and find out where you fall based off the number of people you have. On the left is the size of your household, on the right is the size of your income. So essentially, if we take a look at a family of 4, they could make up to $94,000 and they're going to get subsidized with their health insurance. As you go higher, if you have a family of 5, you can make up to $110,000. What I want to point out with this is, we live in Maryland, and Maryland is a very expensive state to live in, but most states do not have the income levels that we have here. Most people in the nation could qualify for subsidies through the individual exchange. And this goes back to what I was talking about is, does it make sense for the employer just not to offer insurance at all? If the individual employee can go through the individual exchange and get cheaper insurance because it's subsidized versus going through his company, well, he would want to go through where it's cheaper. Remember, this isn't the United States government plan. This is Care First and Care First. It could be the same exact plan. You're paying cheaper for one or more for the other. But from this chart, we can see a lot of people will qualify for subsidies. And that's why it's important to start figuring out what's going on now. There's some specific strategies that are available based on whether you fall in the over 50, the under 50, or if you're an individual. You need to start taking a look at the different situations now. Every business circumstance is different, and that's why we start saying, hey, you need to get on it now and figure out what's going on. It doesn't necessarily make sense to continue offering group insurance when you have these individual subsidies available. Some things for planning, you need to start now. The individual exchange is slated to open on October 1st. Obviously, this could change. Existing groups need to review their options. A lot of you guys that are in small business are probably getting these early renewals. It doesn't necessarily make sense to take those early renewals, so you're going to want to talk to a broker and make sure that you are positioning yourself properly. Groups that don't offer insurance, you need to start gathering some information from your employees now. So if the exchange opens on time, again, October 1st, we can go ahead and get you enrolled in there and get some insurance running. Where do you go from here? We offer free consultations for the most part, depending on your business situation. Fees are discounted if your group signs up with us through for insurance or payroll. And then you can go ahead and contact me to set up an appointment. There's our toll-free number, which is 1-888-929-2729. You can email me at johnp@payrollservicesllc.com or visit our website at payrollservicesllc.com. What I'm going to do from here is I want to go ahead and give you some actual rates on what we're seeing so you can see how the exchanges may work. Okay, so what I did last night is I went ahead and went onto United Healthcare's site. United Healthcare has some really good plans for individuals. They're very affordable and they're very good plans. And so what I did is I took that plan and I compared it with what we know of with the individual exchange with rates. So I created some fictional people here. So the first one that I did was, let's talk about the plan type that we're going to compare it to. And this plan type is very, very similar to what we know that's going to be on the exchange as a base level. It's a $1,500 deductible. However, if you need to go to your primary care doctor for a cold or a specialist, it's a copay. So it's a $35 copay for either or. And that's what we're expecting to see. There's somewhere between $0 and $35 for a copay to go to the doctor. Anything else will go to the deductible. And so that'll be the plan that we're going to look at. So for a 27-year-old male, non-smoker, currently going through the private sector, which is United Healthcare, it's $122 a month. If that 27-year-old went through the individual exchange through ObamaCare, it would be $263 a month. So we see that the young guy gets shafted here for it. And this is based off of him making $40,000 a year. $40,000, because remember, we need to make sure that we take a look at the income level. So at $40,000, he doesn't qualify for a subsidy, and he ends up paying about $140 more through ObamaCare. And we'll start to see where these start to flip around. If we now go to a 35-year-old male, and again, the same plan, through United Healthcare, he's going to pay $154 a month. Through ObamaCare, it's $307 a month. So we still see that the 35-year-old male is still paying more through ObamaCare than through the private sector. We then go and look at the 45-year-old male. At 45, it's $223 a month through United Healthcare and $316 a month through ObamaCare. Okay, and again, these examples are all at $40,000. So again, we still see that he pays more through ObamaCare. The better part would be to go through the private sector right now. Where this starts getting interesting is when we start adding dependents, whether it's a spouse or kids to the equation, and that's really where this flips a little bit. And again, we're going to look at $40,000 again. So if we now take that same 45-year-old male and we add a 42-year-old spouse, the insurance through United Healthcare is $488. The insurance through the individual exchange at $40,000 of income is $276 a month. It's almost $200 cheaper through the individual exchange rather than the private sector. Now, you may say $40,000 for two people, that's ridiculous, John. What are you talking about? That's just way too little on the money. So, okay, so what we're going to do is I increased that 45-year-old male and that 42-year-old spouse's income to $60,000 a year. Again, with United Healthcare in the private market, it doesn't change, so it's $488. Through ObamaCare, if we increase them to $60K a year, it's $475. So it's still cheaper just by a couple bucks, but it's still cheaper through ObamaCare. So again, 45 male, 42 spouse, $60,000 a year, $488 through the private sector, $475 through ObamaCare. Now, here's really where we see the plans start to change a little bit also. Most people get their insurance through their employer. It's group coverage. A lot of people do have individual, but most of it gets through group coverage. Well, if we take a look at the group coverage for an individual employee at age 27, because remember, it's an average age. So a group with an average age of 27, it's $264 a month for an individual. So anybody that's on that group, $264. Well, if that same 27-year-old went through ObamaCare previously, it would be $263 on the individual market. So we still see savings there. Now, if we go and take a look at the average age of 44, which is similar to our 45 example, through ObamaCare, it would be $316 a month. Through the group insurance at 44, it would be $387. So we still see almost a $70 savings through ObamaCare. If we then take a look at our example of the 45 male and the 42 spouse, based off the average age group of 44, it would be $794 through the employer. Well, through the individual exchange, it would be $475. So we save almost $300 there. So all I want to do with this example is just to show you that a lot of people could pay less for their insurance if they go through the individual exchange. That's what I want to show from this. So if you are a small group offering insurance, it's really important to start looking to see if it makes sense to drop your plan and go through the individual exchange or to stay through the individual exchange. There's a lot of different strategies that we have in place for it, but like I said, as you start looking at group insurance versus the individual exchange, you're going to see some savings. And also, if you're in the individual market now with dependents, you're going to start to see some savings as well if we go through ObamaCare with these. I hope this webinar was helpful for you. If you have any questions, please feel free to contact me. Again, it's 1-888-929-2729. Thank you very much.